back from Caring Medical Center. I am so happy to welcome back our next guest to the show, Dr. Timothy Special. He is a prolotherapist at Caring Medical Center. Good morning.
Morning, Carly.
How long have you been doing prolotherapy?
25 years.
25 years. And this is interesting because we've talked about before, it's a relatively new concept here in Southwest Florida. I think some people are hearing about it for the first time.
Absolutely.
We're going to talk this morning, I think, about some very common conditions dealing with the head and the neck. You know, a lot of pain that people are living with on a daily basis, right?
Carly, if you think about our society years ago, people, it's funny, Faith and I my wife were driving today, and you're looking at a lot of workers out there. They're working. We don't do a lot of physical work anymore. We're going to the gyms. We're sitting like we are right now. And unfortunately, we're sitting where we live in a computer world.
Yes,
and
we
because
do.
of that, our posture is like this, and we're not using our muscles and our ligaments properly anymore. It's causing a lot of headaches, which people don't like. They think a headache is usually coming from the head. Most of the time, it's coming from the neck.
Is it really?
Absolutely.
So
it really is.
How do you know where? Is it easy to find maybe what your cause of headaches
well,
is?
It might be. I mean, obviously it could be something with the brain, but most people, it's because of posture, poor mechanics, muscles are weak, ligaments that hold bones together are weak, and people have injuries. What happens is when they come into our office at Caring Medical, Dr. Hauser and myself, we're going to get a good history, and we're going to find out. And I'll ask people, I'm up from Rochester, New York, that's where I'm from, but I live down here now, and we went sledding a lot as a kid, which you guys probably didn't. So, you know, did you have a toboggan and run into a tree? Did you fall off a horse? And they might have done this when they're 5, 10, 12, 15 years old, didn't realize it. Oh, yeah, I did do that, doctor. Or maybe you had a car accident or something happened at work.
Whiplash is very common.
Something happened. And so what are you doing are these post-concussion symptoms? I look at the Tampa, I just paid the hockey.
The Lightning?
Stanley Cup. I'm sorry about it, okay? But anyways, it was a good series. And, you know, these guys will run into the, with their heads, they get these post-concussion syndromes. So it does joggle their brain, but it also affects their neck, and their necks become unstable, okay?
So when does prolotherapy come in? When are you able to use prolotherapy to help if somebody is having headaches and...
That's a good question, Carly. What happens, usually, an injury usually takes 6 weeks to 3 months to heal.
Okay.
So someone will come into the doctor. Now, once they see us and they trust us, they're going to come right to Caring Medical, say, why don't you just treat me? And that's what happens a lot. But many people are new at this or not quite sure. So we're going to examine them maybe 6 weeks, 8 weeks, 10 weeks, 3 months. Now you have chronic pain, okay? Chronic pain is a lot different. There's not a lot of good growth factors. So what we do is injections. We will do, Dr. Hauser and myself will do injections to the ligaments, okay? And if you look at right here, that's the cervical spine, and those are the facet joints, okay? So if you went to a manual therapist, massage therapist, any sort of manual therapist, they may manipulate that. And you know something? There's a place for manual therapy. I'm an osteopathic physician. I do manual therapy all the time.
Okay.
And it does work, but sometimes too much of it causes instability. And prolotherapy, as you see, we're doing those injections, we can rebuild that naturally.
It's interesting that you can do it. I mean, we've talked about whether it's the neck or the spine, knees. Something else we have not talked about yet of what prolotherapy can be used for is TMJ pain.
Excellent. And my cousin's a dentist, and I've taught him about this, and it's a fabulous procedure. If you look at the jaw, you know, you think about it, besides chewing gum, which we do, if you chew down on a steak, think you and I are just, you know, discussing things right now. We use this jaw, I mean, thousands of times a day, okay? And they're held together. If you look at the anatomy, it's ligaments. Ligaments hold bones together. That's all we're really doing, so they can be sprained. So many people can have irritants in the jaw, and many times what I'll do, Carly, I will have them go to the dentist, okay, to maybe give them orthotic, so they can maybe, they're biting down at night, but even that, then we can inject the jaw with irritants, prolotherapy, to rebuild the jaw. Works very, very good.
Well, again, it goes back to, you know, I love that you say, hey, there is a place, you know, possibly for surgery. There is a place for, you know, chiropractic.
Sure.
There is a place for everything. People need to maybe look at that place and think, I don't, can prolotherapy help, right?
Prolotherapy, you know, it's a huge piece of the puzzle. They're going to see a lot of these other therapists a lot less, and I know. But you know something, isn't that what we really want to do in medicine? We want to help people get better. You know, and I think that's the bottom line. If prolotherapy can help most conditions, I think most people should give it a try.
So if someone's watching this morning, what would you suggest they do when they want to find out more? Maybe they want to meet you, Dr. Hauser. Again, you have a great staff there that's very willing and eager to meet people.
I give the staff a call. You know, they're very educated. We have great literature to give you. Some people like to read. Some people like to go on the website. We have a great website. And just give us a call. Check the website out. If they feel it's something, it would be a consultation, and we can examine them, and we'll tell them if we can help them or not.
Learn more, and yeah, try to erase that chronic pain that I know a lot of people are struggling with on a daily basis. Dr. Special, thank you so much. We love when you're here. We look forward to having you back.
Thanks, Carly.
For more on Caring Medical Center, all you have to do is go to our website as well, fox4morningblend.com.
One last look at your Fox forecast, and then we'll be right back.